AF is a very complex disease. It can occur de novo, which means that it happened on its own, or it can be associated with other conditions, from binge drinking to structural heart diseases. Because AF is a very interesting disease, this can happen like a paroxysmal form. In that case, it comes and goes. It can also be persistent, so it's always there. So if it is always there, then it is very easy for you to pick up. However, if it comes and goes, then you may not be able to pick it up when the patient doesn't have any symptoms. Depending on how you screen it, in the global scale, I think the prevalence reported was about 1 to 4%, so it's really significant. But it's, as I said before, it affects the elderly more than the young people. So tachycardia literally means fast heart rate. So any heart rate above 100 beats per minute is tachycardia. However, tachycardia can be caused by many conditions. For example, when you are anxious, when you are exercising, then you have a physiological form of tachycardia. However, atrial fibrillation is not physiological, it is pathological, which means that it can be fast without a need. So in patients with atrial fibrillations, the fast heart rate can happen without you needing it. So that's the problem. And not all the patients have symptoms. About 50% of them can be asymptomatic totally. On the other hand, some patients can be very symptomatic. They can have palpitation, which feels like a heart racing. They can have chest discomfort, or some of them they can just feel like they can't do as much exercise as before. They get tired very easily. Yes, atrial fibrillation, if untreated, they can result in damage to heart and also other systems. I mentioned about stroke, and in fact, no matter whether this is a paroxysmal form or persistent form of AF, it can result in stroke. However, in some patients, they don't have any symptoms. The AF can be there for many weeks without noticing them. Then they can run into a heart failure, so the function of the heart deteriorates because of that. I think it is really controversial. So some studies actually reported a protective effect from coffee. On the other hand, some of the studies actually found it's neutral, or one study actually found coffee to worsen AF. So I guess it's also because of the ingredients inside the coffee. So some people say it may not be caffeine itself, but maybe something else that is causing the problem. A little bit of exercise actually is better than nothing. So moderate exercise actually can reduce your risk of atrial fibrillation. On the other hand, among those endurance athletes, the risk of atrial fibrillation actually increases by 2 to 7-fold. So it's actually quite a lot. So some people think that it's because of the damage to the heart imposed by endurance exercises. The only thing that is most associated with atrial fibrillation is alcohol drinking. It's not just like binge drinking, but even a moderate consumption of alcohol has been shown to increase the risk of atrial fibrillation. So in patients who have persistent atrial fibrillations, a 12-lead electrocardiogram, we call it ECG, and 12-lead ECG will be sufficient to pick up atrial fibrillation. If the patient has a paroxysmal form of atrial fibrillation, that will be a little bit more tricky, because when they go to see a doctor, they may not have the symptom, they may not have the AF. Depends on the symptoms and also the severity of the condition. So some of the patients, they are fine with atrial fibrillation and they only need on-demand medications when they have symptoms. For the others, they may need medications every day. For patients who have very serious AF that fail to convert back to normal, they may need an electric shock, which is given externally to convert them, restore their original heart rhythm. Moderation of alcohol consumption is very important, and in fact, for patients who already have AF, sometimes I would just advise them to quit. Obviously, exercise, but a moderate amount of exercise instead of like a very strenuous exercise every day.